Hey, it's Alvin from Priceline Pharmacy West Brunswick, and we're doing the Q&A session today. I apologize for being like 6 minutes late. Had a few technical issues, so here we go. So just remember, this Q&A is interactive. I've just taken questions that people have asked during the week. And certainly if you're coming on live now on Facebook, you can ask me a question and you're in the comments section below, and I will do my very best to answer them for you. So just a big disclaimer in the beginning, you know, this is just general advice. So for situations, you know, for your medical conditions, please make sure you come and see one of our awesome wellness consultants, and we can deal with your queries in the proper fashion. But this is just a general overview from some of the questions that a lot of you guys have asked us over the past week, and hopefully if you're coming on live now, you know, I can answer your questions for you. So let's get into it. So the first question that we've got is from Heidi. I'm just reading my notes up here. And Heidi asks, Alvin, my oral antihistamine is not working. What can I do? So yes, oral antihistamines were usually the first line of treatment for managing your hay fever symptoms. But the technology's come a long way now. So generally we recommend using a low dose corticosteroid nasal spray as first line treatment, generally along with your antihistamine tablet. So what is a low dose cortisone spray? Well, there's many of them on the market, but they work really well at reducing the swelling and inflammation in your nasal passages, and also making your nasal passages less sensitive to the pollen. And the guidelines in Australia state that you know, you're better off using a nasal spray first line to manage your hay fever. So there are so many different nasal sprays that we can use. Come in and see one of our pharmacists or one of our wellness consultants, and they will determine the right one for you. The other really common mistake that people make when treating hay fever is not using a saline spray or a saline wash, and that's really good at rehydrating the nasal passages and flushing out the excess pollen. Typically, with if your hay fever is really bad, Heidi, for the first few days we can recommend using a preservative-free nasal decongestant, something like what we use for a cold and flu, in conjunction with a low-dose corticosteroid spray, as well as your tablet. Now, it may seem like overkill, but you know, this is the joy of living in Melbourne with all this hay and pollen floating around the air. Quite often, a lot of our patients need to go the full route of managing their hay fever. There's some, you know, misconceptions about the word steroid and cortisone. Some people don't like that, but you know, they're totally misfounded. They really are very safe because they're a super low dose, and you will notice some amazing relief in your symptoms. And of course, there's the whole preventative option as well, which you can take, which we can go through with you in person, but basically using stuff like vitamin C, quercetin, marshmallow in these natural ingredients, and of course probiotics. How can we forget probiotics? Particular strains of probiotics, super useful for dampening your immune response to hay fever. Cool, so hopefully that answers your question, Heidi. If you've got any more questions, come in and see us in the pharmacy, of course, or pop your questions in the comments below. Second question is from Angeline. Hey Ange, she's asking me what vitamins are good for hair and nail growth. So let's go through them. Some of my favorites to use are fish oil. So fish oils contain omega-3s, or any other form of omega-3 really, and they're really good at nourishing your hair and your skin. Omega-3s come in so many different forms depending on your dietary requirements, but you know, typically we use fish oils, but if you're vegan, we've got other sources as well, so make sure you come in and see us. The second thing I would use, Ange, is some zinc. So zinc's really good at stimulating hair follicle growth, also really good for skin repair as well. So that's it. And the third thing I would use is silica. So silica is really important in collagen synthesis. So collagen's a part of our skin, part of our hair, and you know, it just helps the collagen build, if you will, to keep it nice and strong. And also really good at preventing hair loss and, you know, healing up skin conditions really nicely. Silica you can even apply to your skin and hair as well. So, and 3 vitamins that are quickly recommended for you that are good for hair and nail growth. Certainly if you come in and see us, we can put together a plan for you based on your specific needs and your medical conditions and so on and so forth. But that just gives you a general overview, and in fact what I might do is I will probably do an in-depth video explaining some of the other vitamins that I would use to that are good for your hair and nail growth. Cool. So hopefully that answered your question, Ange. Third question from Stefan. Stefan says, my knee hurts after I run, what can I use? Stefan, I'm a runner too, so I know how that feels like. So, I mean, the basics, obviously, I would just make sure that your technique's all good, check out your techniques, good activation exercises as well, so maybe some of our physio and osteopath friends can chime in here and help us with that. But let me help with how we could manage it pharmacologically and also naturally. So the first thing that we would do is, if you're able to use anti-inflammatories, Stefan, we would use anti-inflammatories. There's a whole host of anti-inflammatories that you can buy in the pharmacy. And generally, if it's been inflamed, using an anti-inflammatory might be the way to go for you as well in helping you recover quickly and managing some of the pain. Certainly from a preventative sense, using magnesium is also really good, so that relaxes the muscles around the joints in your knees and also helps your muscles recover really quickly. And you probably find that a lot of people who work out or who do any strenuous activity, it's always recommended to use magnesium. It just helps your body recover really, really quickly. So the other thing I would be adding to your regime to consider would be some coumarin. So coumarin's a natural anti-inflammatory that we've been using a lot with our patients. So that if this is an ongoing injury or something that's happening all the time, apart from getting your technique checked and getting to the underlying cause, using coumarin long term, is a really good idea in managing the inflammation and the pain, and obviously, with the main result of helping you get back running sooner. And then you've got the obvious stuff, well, may not be obvious, Stefan, but the fish oils and the glucosamine. So fish oils are really good at helping you reduce inflammation. Also good at lubricating the joints, so that could be part of your regime, and also taking glucosamine if you're able to take it, because glucosamine is really good at rebuilding the joint cartilages, especially around the knee area for you runners there as well. So, Stefan, there would be some of the things that I would be recommending for you to help with your knee after you run. Cool. If you have any further questions, Stefan, please make sure you come in and see us in the pharmacy or leave your questions in the comments below. The last question we got today is from Kristin. Kristin asks, why can't I take cold and flu medicines when I'm taking blood pressure medicine? So Kristin, great question. You probably hear when you come into the pharmacy, this is one of the questions that our wellness consultants and our pharmacists will ask. And the main reason is that most of the cold and flu tablets have an ingredient in there, the decongestant, pseudoephedrine or phenylephrine, which if your blood pressure is not controlled or if you've got heart conditions, will increase your blood pressure and place extra strain on your heart. So it's really something that we don't recommend unless your blood pressure is under control. So, Kristin, so that's why we asked that question. And some people who have accidentally taken it may feel a little bit funny because their heart starts to race a little bit and they're not used to that level of activity because their blood pressure has usually been under control by taking a blood pressure medication. And then you take something like a cold and flu tablet, which then counteracts that and then starts racing your heart, and then you're just wondering what's going on. So that's our general. That's my general spiel on that one, Kristin. I hope that answers that for you without me getting all geeky and too complicated. Cool. So they were all the questions that I got this week. So as always, just remember. This is just general advice. Please always consult your healthcare professional, your doctor or your pharmacist, and make sure you always come in and see us so we can give you an individualized treatment plan. And lastly, I just want to thank you guys for watching. Please, if you have, we'll go again live next Friday at 10 a.m. If you have any questions, please make sure that you pop them in the comments section below. Any feedback, any styles. I've changed rooms this time. Hopefully you can hear me properly. We had some comments last week that I talked for too long, so whether it's too long, too short, whether you want me to wear a wig or, you know, I don't know, whatever. But any feedback would be great, because the main aim of these Q&A sessions is to give you more value and to see that if there's any way that we can help you get better sooner. Yeah, cool. Thanks guys, have a great weekend, and I look forward to your comments, your questions and comments in the comment section below. And please make sure you share and like this video and get it out there, and so more people can receive value from it. Thank you.